Become yourself again with MonaLisa Touch. It's okay to talk about it. Gynecologic health is an important aspect of a woman's overall well-being. When estrogen levels decline due to menopause, women experience changes in their gynecologic health. And studies show that only 25% of women seek help from their doctor. Now with MonaLisa Touch, there is a treatment to address these changes. This procedure has been described by patients as life-changing, and they want to talk about it. A large portion of postmenopausal women and women treated for breast cancer or induced menopause are experiencing changes in their gynecologic health. The MonaLisa Touch offers a non-surgical approach to deliver lasting relief that is typically noticed after the first treatment. MonaLisa Touch offers women a new therapy that has minimal side effects, no downtime, and lasting results. It's time to talk about it because now you can do something about it. Patients typically describe MonaLisa Touch in 2 words: simple and safe. How does MonaLisa Touch achieve these results? Similar to your yearly exam, a probe is inserted into the vaginal canal. A gentle laser is fired, and a pattern of microablative wounds target the vaginal tissue. The injury triggers a wound healing process that causes revascularization and increases in collagen in the vaginal mucosa. The therapy requires 3 treatments, each lasting less than 5 minutes. Because no anesthesia is required, and it is done in your doctor's office. The best part? No downtime and virtually no pain or side effects. When women are experiencing changes in their gynecologic health, being treated with the MonaLisa Touch may positively impact their overall health and also their quality of life. MonaLisa Touch has been successfully treating women since 2012 and delivering results that have been overwhelmingly positive and immediate. The MonaLisa Touch difference allows you to feel better with no downtime and minimal discomfort, which is important to you and your doctor. With MonaLisa Touch, it's not only okay to talk about it, it's okay for you to talk about it too. Talk to your doctor today about MonaLisa Touch and become yourself again.
And welcome back to the news at noon. It is Medical Monday, and joining me right now is Dr. Kathy Slusher. So you all have just introduced a new procedure at Harrisonburg OBGYN.
We are, and we're so excited. This is probably the most excited I've been in a long time coming on here because we have the MonaLisa Touch. And it's so exciting because it offers hope, and it is a huge game changer for postmenopausal women and especially breast cancer survivors. It is a treatment that uses the CO2 laser to give vaginal treatment to bring back the tissue, bring back the blood supply, and make everything comfortable so that if the dryness is a problem, it's fixed. If painful intercourse is a problem, it's fixed. It was designed for that postmenopausal woman, but like I said, you know, in the past we've had estrogen therapies, basically we've had lubricants, we've also had the intensity that I've talked about, which is still, you know, a viable device that's non-medical, but now we have this. And what happens is you have a 5-minute or less treatment that is not painful, and then 6 weeks later another, and 6 weeks later another. So 3 treatments, less than 5 minutes, and then you're done. And all you need is a touch-up a year later. And what's absolutely awesome is that people start to see the benefit almost immediately afterwards. Like, we rolled out the procedure, and I want to say everybody in our office is professionally trained and certified. We rolled out the treatment last Monday, the 8th, and already we're getting reports of improvement. And And if you go to the testimonials online, you will just see that it is a game changer for so many people. It was designed for that breast cancer survivor, but it's great for anybody in the postmenopausal or perimenopausal time that is having these symptoms. Additionally, you can use it on the outside, on the vulva, for people who have dryness and skin conditions there. Now, this is a big word. We've talked about it before on TV, called lichen sclerosus atrophica, or LSAT. Most people don't know what that is, and it's a big word, but if you got it, you know it. And it's uncomfortable, and it's painful, and it's previously treated only with steroid creams, and it's a postmenopausal lifetime event that you have to constantly stay on top of. This treatment, the laser on the outside, works for that too.
Now, do people have to do anesthetic for this, or is it just they come right in? And
no, they come in. We do a topical anesthetic for the outside, as you might imagine.
Right.
It's a little more tender. But for the inside, no. They come in, they have the treatment, they go home. And we do have a gel that you use again on the outside because it can be a little irritated or sunburnt. But actually, the two that we did last week are not, well, one of them, I haven't talked to the other one, but one of them has had no sunburn, no problems, no irritation, but she's feeling the benefit already. And that, you know, it's really, the reason I'm so excited is because we're making such a positive difference in self-esteem for women and how they feel, in their intimacy, in their relationships. And, you know, you just,
absolutely.
how can you say enough about making people feel better about themselves and their lives and their relationships?
All right.
You can't say enough.
Yeah.
So we're excited. MonaLisa Touch.
And we have all your information right there on Evelyn Byrd Avenue, phone number, and harrisburgobgyn.com. Well, thank you as always.
You're welcome.
And we'll be right back with a final look at your forecast.
Love, intimacy. Women deserve to live life to the fullest. To the fullest. To the fullest. Even after menopause.
There's been a change, and I'm feeling strong. This is my life, gonna live it long. Nothing can shake me. This is my world again. Not gonna break me, 'cause I live in the way I wanna be.
Did you know that up to 50% of women in the U.S. are suffering?
We're living longer and we're living better. We do not need to accept this.